Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. Today we have a guest returning, Dr. Eric Osansky. He is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness and has been helping people with thyroid and autoimmune thyroid conditions since 2009. So I bet you can guess what we're going to talk about today. It is your thyroid. So he is the author of the books, Natural Treatment Solutions for Hyperthyroidism and Graves Disease, the Hyperthyroid Healing Diet, and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with different types of thyroid and autoimmune thyroid conditions, including hyperthyroidism and Graves' disease, and hypothyroidism and Hashimoto's Thyroiditis. Welcome, Dr. Osansky.
Hey, thanks for having me, Dr. Stein.
It's really nice that you are now being interviewed around the same time that your summit is coming out. So it's perfect timing.
Yeah, excited. And of course, you're part of that. So yeah, it was great interviewing you for that. So yeah, exciting times.
Yeah, awesome. So I would love for you to, we're not going to have a whole lot of time talking about your specific journey, mostly because we've talked about it last time. I'd love to just dive down into, I usually like to do that, especially with new guests, but, just because it's so wonderful to see, how people even get into the field that they're doing. But I just, described it in the introduction. So I would love to just dive right into talking about, hypothyroidism and hyperthyroidism. And I think sometimes people don't really even know the difference between the two. Do you think you could start there?
Yeah, of course. So I will say that hypothyroidism is a lot more common than hyperthyroidism. And with hypothyroidism, some of the more common symptoms with hypothyroidism, fatigue,
Mm-hmm.
weight gain, coldness, constipation, hair loss or hair thinning, brain fog, hyperthyroidism with you have increased resting heart rate, heart palpitations, tremors, weight loss in many cases, hair
Mm-hmm.
loss also. We'll talk about anxiety and depression, anxiety in both hypo and hyper. So of course we'll get to those symptoms as well. But we have loose stools, we have insomnia. So why? Why do people have those different symptoms? And it's because with hyperthyroidism, you have elevation in thyroid hormones, so everything's kind of revved up. Whereas with hypothyroidism, everything, the thyroid hormone is on the lower side or overtly low, and so everything slows down. So that's why it makes sense with hypothyroidism. You'll get that fatigue because you have the lower metabolism. You'll get the weight gain, and you'll get other symptoms like sluggish bowels, constipation. Whereas with hyperthyroidism, because you have that increase in thyroid hormone, you'll get that elevation at resting heart rate and the other symptoms I mentioned.
Right, right. Yeah, I consider the thyroid as a organ that's right in the neck area, above your Adam's apple, that kind of it regulates your metabolism. So everything either speeds up or slows down, and it's the thyroid's job to have it right at just at the right spot, right? So
Exactly.
people will have symptoms of depression and anxiety in both conditions, the hyper and the hypo. But depression seems to be more common with hypo, with anxiety being more common with the hyper.
Exactly.
Yeah.
Yeah.
Yeah. So I find that I find that there are a lot of people who have thyroid problems and they already know that they have thyroid problems. They may not necessarily know that they have an autoimmune condition, I know that that plays a large part, at least from our standpoint, but in the conventional world, it's kind of ignored having antibodies. Can you talk more about that?
Sure. So, as you mentioned, autoimmunity is prominent with both hypo and hyperthyroidism. Most cases of hypothyroidism are Hashimoto's. Most cases of hyperthyroidism are Graves' disease. There certainly are exceptions. But when it comes to conventional medical treatment, it really doesn't like the treatment's going to be the same regardless. So with Hashimoto's or Graves, yes, you have the elevation thyroid antibodies. So Hashimoto's, you got those elevated thyroid globulin antibodies and or thyroid peroxidase antibodies. Graves, elevated thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And some people have a combination of these antibodies. It's not uncommon for people to have both Graves and Hashimoto's antibodies. But the medical doctors, including endocrinologists, they're going to target mostly the symptoms. A lot of times just look at the TSH, and not really even the symptoms, but more so they'll usually run the TSH, and especially in the case of Hashimoto's, if that's elevated, sometimes they won't even look further than that, and they'll just put the person on thyroid hormone replacement, because even if they were to test the antibodies, that still would be the treatment, is in the case of Hashimoto's, to give thyroid hormone replacements. With Graves, it's a little bit different. Usually they will do more than just the TSH. If they see it depressed, they'll usually at the very least do a free T4. Sometimes they'll do a free T3, but with there could be other types of hyperthyroidism that don't justify taking antithyroid medication. So actually, in the case of Graves, not all the time, but many times they will look at antibodies. But even in that case, when they look at antibodies, many times it's like one time. We'll just look at the antibodies, come up with a diagnosis, and still treat the thyroid and do absolutely nothing for the immune system.
Right, right. Yeah, that's been my experience as well. And they may not necessarily follow the antibodies because they don't see any reason to do that. So, you said medical doctors, but I think you meant conventional medical doctors, right?
Yeah.
Yeah,
Yes.
because it's really the conventional world. Most functional medicine doctors will do more,
Yeah.
and not just more in terms of solutions, but also more in terms of testing. So can you talk more about that? What other tests would you get besides the TSH?
Of course. So yes, so TSH, which is thyroid stimulating hormone and is actually a pituitary hormone, and then the thyroid hormones. So T3 and T4 are the two main thyroid hormones, at least the ones that could be tested. There's also T1, T2, which we currently can't test for. But T3 is the active form of thyroid hormone. So it's frustrating when doctors just look at look at the T4. And you could look at free T4 and T3, total T4, T3. I prefer the free hormones, although one could say in the case of Hashimoto's, there's a time and place to look at the total thyroid hormone to see how much the thyroid gland is actually producing. And then there's the antibodies. I mentioned the three main antibodies, the two that are more closely associated with Hashimoto's, and then the thyroid stimulating immunoglobulins with Graves, although a lot of people with Graves also have the TPO antibodies. There's reverse T3. So I mentioned how T3 is the active form of thyroid hormone. T4 actually converts into T3. Reverse T3 is the inactive form of thyroid hormone of T4. And it kind of tries to, I mean, there's still some controversy over what the function of reverse T3 is, but it seems like it blocks thyroid hormone entry into the, like when, for example, in the case of hyperthyroidism, you have elevated reverse T3. In fact, I usually don't test reverse T3 in my hyperthyroid patients anymore because I expect it to be elevated. And it makes sense. You have elevated thyroid hormone levels, so it's trying to block, like you don't want to have that conversion, trying to block that conversion. But you don't want to see that in Hashimoto's. You wouldn't want to see an elevated reverse T3. You want to have that conversion of T4 to T3 taking place.
Right, right. And so if you have an elevated reverse T3, that usually means something. What does that mean? What's going on even in a Hashimoto's hypothyroid state?
Yeah, well, like I said, it could be and commonly is related to conversion problem, T4 not converting to T3, but even other things like inflammation can cause reverse T3 to be elevated. And again, what's also important to mention too is that it doesn't necessarily, and this goes not just for reverse T3, but these other numbers, like, and you know this, but most conventional medical doctors and endocrinologists don't really pay attention to the optimal ranges. So reverse T3, like I would say, if it's like 18, 19, 20, that's kind of on the higher side,
Right.
but still within most reference ranges. And we could even say the same thing with thyroid hormone levels. If they're on the higher side, why are they on the higher side? So yeah, it's again, I know we're going to talk more about optimal ranges, but
Right, right.
kind
I
of,
mean,
yeah.
we can talk about that right now, but I do want to finish the point about reverse T3. In the days when I was in medical school, which is over 30 years ago, we used to call that euthyroid 6 syndrome. And it's almost like the body's going into hibernation of sorts because it's in overdrive, and it's the way for the body to put on the brakes. And that's a state where the body is really, really inflamed. To me, it's like like an inflammatory marker, in my
Yeah.
opinion. So I think that's an emergency state. And years ago, before we had hypothyroidism was actually quite rare. And I'm talking about in my time, in the 1990s, it was actually quite rare to have a hypothyroidism. And we were taught that it was in the elderly, and that people would go into a coma from being hypothyroid. And so it's so much has changed even in 30 years. But there are a lot of things that can affect your thyroid uh, to not function appropriately, and those are some missing nutrients that are really, really important. And in order for the thyroid to make that conversion of that inactive free T4 to the activated form of free T3, can you talk about those minerals and vitamins that are necessary?
Yeah, I mean, we might as well go into the whole picture with, I mean, because there's not every like there are nutrients also important just for thyroid hormone formation, such as
Mhm.
tyrosine, which is an amino acid, and so that's important. Iron is important, selenium when it comes to production of thyroid hormone, and also plays a role in the conversion. I mean, iodine, a lot of controversy with iodine
Mhm.
and thyroid health. And it's important for healthy thyroid hormone levels, but iodine also, too much iodine could make someone hyper. It could exacerbate the autoimmune response in both Graves and Hashimoto's. But yeah, so we got tyrosine, I mentioned selenium, iron,
Mhm.
iodine
Mhm.
are some of the more important nutrients
Mhm.
that are
Yeah.
important when it comes to
Yeah.
thyroid health.
Zinc is a big
Zinc,
one too,
yeah.
right?
Zinc,
Yeah.
vitamin A, when it comes to
Mhm.
like the receptor, there's a condition called thyroid hormone resistance, where kind of like insulin resistance, where you have plenty of thyroid hormone, but it's just not entering the cell. And the nutrient deficiency, zinc actually could also play a role with that, not having enough omega-3 fatty acids, as well as
Right.
a vitamin A deficiency.
Right.
So yeah, you got to look at the production of thyroid hormone, the conversion of thyroid hormone, and then, yes, thyroid hormone entering into the cell.
Right, right. So I think it's really important to emphasize that getting these nutrients on board before even putting yourself on thyroid hormone, it's really looking at your health and your diet, and whether or not you're even able, if you are having those foods in your diet that are high in these nutrients, then it's making sure that you're actually absorbing those nutrients, that your digestion is in order to absorb those nutrients to get to into your cells. And the other piece about that is looking at all of the numbers in the context of other things happening in the body as well.
Yeah. Oh, I definitely agree. So you want to make sure that you're eating a healthy whole foods diet, getting those nutrients in, and at the same time, you're right, you need to have proper digestion, so you're breaking down those nutrients, absorbing those nutrients, and yeah, sometimes there is definitely a need for testing. I mean, not necessary. I mean, there's different perspectives when it comes to testing. I can't say I test for every single nutrients that we just spoke about, but if someone's eating a whole healthy foods diet, but as far as like digestion and absorption, there's definitely a time and place for doing like a comprehensive stool panel, or if we suspect someone has maybe like SIBO, small intestinal bacterial overgrowth, and maybe we'll do like a blood test to see if someone has SIBO. But yeah, you're absolutely right.
Right. Yeah. I mean, 33% of that conversion from T4 to T3 actually happens in the gut. And, it's really important to make sure that the gut is functioning appropriately. The other thing that's important is making sure that a person is not in this high stress mode where their adrenaline is rushing.
Yep.
And because when the adrenaline and cortisol levels are high, what the thyroid does is it actually puts on the brake to bring balance to the body. It's going to respond to that high stress state in a normal way. That is the way the thyroid is supposed to respond. So sometimes, some of these numbers are in the lower range of normal because it's working appropriately. So it's looking at in context of the other organs that are playing a part. What are some other things that affect the thyroid functioning in terms of other organ systems?
Well, you mentioned the importance of having a healthy gut in conversion, and you also just mentioned the role of stress also affecting the thyroid and also can affect that conversion process.
Mhm.
Most of the conversion of T4 to T3 actually takes place in the liver, though. So having a healthy liver is extremely important. So yeah, I agree. Healthy liver, healthy gut, healthy adrenals. Those, I mean, really for any condition, not just thyroid, but getting to that conversion process. Those three areas definitely are big.
Mhm.
And again, remember, just a reminder that the brain, pituitary are important because they have to communicate. The hypothalamus has to communicate with the pituitary gland, which in turn communicates with the thyroid gland as well. So
Right.
yeah. So, but
What
but
are
yeah,
some of oh, go ahead.
no, that's okay.
So what are some of the things that a person can do to bring the antibodies down to normal?
Yeah, great question. So there's something called the triad of autoimmunity, where
Mhm.
there's three components necessary for autoimmunity to develop, or essentially autoantibodies to develop. So we got genetics, which obviously we can't change your genes. We can do things to modify expression of genes. But then there's exposure to one or more environmental triggers, and then an increase in intestinal permeability, which is a medical term for a leaky gut. So really, it's all about finding, removing triggers, correcting underlying imbalances, healing the gut. I mean, I make it sound easy, but it definitely can get complex. And in my book, Hashimoto's Triggers, I talk about a lot of different triggers. So there could be a lot of different factors, ones that we overlook, like mold, for example, is one that could be a factor. And
Mhm.
many people just look and say, oh, there's no visible mold in my home. It's not an issue, but there could be underlying. And so, I mean, there are potentially obvious triggers, but then there are others that maybe are not so obvious. And similar with the gut, you could have a leaky gut, which many people do, and not have any digestive symptoms. You might have other types of symptoms, maybe even brain-based symptoms. And, but focusing, again, most people will focus on digestion when they think of a leaky gut. But
Mhm.
yeah, so trying to find and remove the triggers. I mean, diet and lifestyle definitely play a big role. Cleaning up one's diet, again, we spoke about eating whole healthy foods, trying to do a good job of managing stress, getting sufficient sleep. I mean, those are the basics, but I find that we need to dig deeper with many people, if not most people, and do some functional medicine testing in order to try to remove the triggers. And then similar with the leaky gut, like what's causing a leaky gut? Like a lot of people just jump to the bone broth and maybe take some supplements, but we got to try to figure out, are you still consuming gluten, which can cause a leaky gut? Or do you have some type of gut infection that is increasing intestinal permeability?
Right. And stress is
Yep.
a major root cause as well.
Yep.
And so, and it could be a combination of all three. So it's really looking at all of those factors. That's important. Yeah. I'm glad you mentioned mold because I actually had a patient recently who had been doing very well. I saw her a few years ago, back in 2020, I think. And she did very well after working with me for a year. And then she called me back up saying, my thyroid numbers are all over the place. I don't know what's going on. I feel terrible. And, after being very stable for a few years and, come to find once we got her stabilized and really looking at like what really caused it, it was a combination of stress and living in a moldy home. So it's and I think, once we saw the results of the mycotoxin test, just how high her mycotoxins were, like that's when we kind of connected the dots. A lot of people don't realize just how they do have mold and they just didn't put it together. Really, you really have to put your detective's hat on and look for it. And, I cannot emphasize how hard it is to find it. And it might be behind a panel that's covered, like underneath an air conditioner unit that's been in a window that you don't take out and store
Yep.
it away or clean up the filters. It just sits in the window year round and there's all this mold all around it. Or the refrigerator dispenser, it has mold in the dispensing piece of the unit that's part of your refrigerator. It's just all this mold inside, including your dishwasher. There's so many places that people don't even think about that can get moldy and really increase your exposure to mold. So strongly recommend that that people do a deep dive in looking in all areas of their home inside and out for places where mold can be getting into your day-to-day environment. Yeah, I'm glad you mentioned
Yeah.
that.
Yeah. Again, there could be, I mean, stealth infections too, like Lyme disease. I can't say it's like something I see with all my patients, but I had Lyme and I didn't have evidence of a tick bite or the classic bullseye rash. I didn't have that. Didn't even have the typical symptoms of Lyme. Mine were more neurological, and they didn't
Right.
even want to test me for Lyme. They wanted to refer me to a neurologist. And this was after Graves, so I can't say this played a role in the trigger, but I have seen Lyme, Bartonella, other stealth infections be a factor. But
Mm-hmm.
again, it's one that we don't think of, or a lot of people don't think of, unless if they have an obvious tick bite or maybe if they're having the classic Lyme disease symptoms.
Right, right. Well, Epstein-Barr virus is a major pathogen
Yep.
for thyroid and Hashimoto's in particular.
Hmm.
So yeah, I agree with you. And in terms of increased gut permeability, it's gram-negative bacteria that cause an increase of lipopolysaccharides that can cause a leaky gut. So
Hmm.
yeah, it's great that we're mentioning all of the things that could be connected to causing these problems. What are some other solutions that you can discuss besides diet?
Yeah. So, I mean, you mentioned stress. I mean, in my case, stress was huge. And when we think about stress, it's not just emotional stressors. Like in my case, overtraining was a factor too. And that's
Mm,
something that I also see with other patients. Some people just overdo it, and it doesn't have to be running marathons or triathlons, although those certainly can be a factor as well. But in my case, it was just going too hard at the gym and dieting and detoxifying and just really putting too much stress on my body that way, in addition to the emotional stressors. So that definitely is a factor. Again, one's toxic burden. We live in a toxic world. We can't
mhm.
change that, but we can do things to minimize our exposure to environmental toxins, especially in our own home. I mean, you mentioned mold, but there's plenty of other toxins that we're exposed to in the cleaners, the cosmetics, the water that we drink and that we bathe in,
Right.
and of course the food we eat as well. So, I mean, just try, I mean, even I mean even the mattress that we sleep on. Again, I'm not suggesting everybody should replace their mattress, but when you think about it, we spend, I mean, just the bedroom, like evaluating your bedroom, we spend, hopefully most people watching this, 7 to 8 hours at least in our
Yeah,
bedroom, sleeping. And again, trying to reduce the toxic load, the electronic pollution as
right.
well in our home, things again, and something else that people commonly overlook.
Yeah, it's not about putting yourself in a bubble. It's just being more aware and educating yourself and reducing the load as much as possible and supporting your body to be able to remove these toxins more readily. And making sure you have good bowel movements and supporting your liver and your kidneys to be able to work efficiently, essentially. Yeah. Great.
Exactly.
Great stuff. So yeah, I would love for you to tell people more about the thyroid summit that's coming up, Save Your Thyroid Summit.
Yeah, so it's called Save My Thyroid and has 36 presentations, including your presentation. So definitely check out Dr. Achina's presentation. And we definitely go deeper than we did during this conversation with different topics, including one on mold and
Mhm.
obviously yours. You talk about depression and anxiety and again, so many different topics ranging from diet, stress management.
Mhm.
So yeah, it's really just designed to help those not only with autoimmune thyroid conditions, but if someone has a non-autoimmune thyroid condition, potentially help to find some of the triggers, underlying imbalances, healing the gut, all those great things. So yeah, that will be starting October 24th and running through October 27th, I believe.
Awesome. Yeah, and everyone will get an email with the link to sign up for that.
Yep.
Great. Yeah. Well, it was great talking to you for everyone to get a preview of the summit. And if you have a thyroid problem or someone you love or know that has a thyroid problem or might have a thyroid problem, let them know about the Save My Thyroid Summit. I thought it was Save Your Thyroid Summit, but it's Save My Thyroid Summit, and have them sign up. So thank you so much, Dr. Osansky, uh, and I'll see you there.
All right. Thanks again, Dr. Stein. It was great having this conversation.
Yeah, me too. Thank you.